you guys to the emergency department today?
This is Nate. I'm bringing him in. I'm his friend. I found him today at his house, unconscious on the floor. I think he's hit his head.
Okay.
He's up now. He hasn't had anything in a couple hours, but he's just wanted to get him worked out a little bit.
Okay, yeah, for sure. All right, can I get your name and date of birth?
Nate Stillman, 2/16/94.
Okay, can you tell me a little bit about what's going on today, Nate?
I don't know. I was just relaxing at my house, and then I got forced to come here.
Okay. Have you been drinking lately?
Yeah, I've been drinking.
I came in the house. He hadn't been answering my phone calls. He was passed out on the floor. His head on, like there were liquor bottles around the house, and the trash can was full of beer cans. So I'm sure he's had a good bit to drink.
Okay.
Seems like it's been a trend lately.
Okay. Yeah, it seems like you've had quite the night. Do you remember falling and ending up on the floor?
No, I just remember drinking like I normally do. And then this nosy Nelly over here wanted to invite herself into my house, thinking that she's always welcome.
Have you been having sleeping difficulties at night?
Yeah, I hardly get any sleep at night. All I think about is, my past and the stuff I've been through with my military history.
I'm sorry to hear that. I'm sure that is really unpleasant. Would you mind answering some questions for me?
Sure.
Okay, can you tell me your name?
Nate Stillman,
And where are you at today?
in the hospital,
All right, and why are you here?
because I was forced to come here by that girl sitting over there.
Okay. And have you had any thoughts about harming yourself in any way?
No. All I think about is explosions, gunfire, people dying, and that's all I know anymore. That's what my life consists of.
Okay. Well, I'm sure we'll probably make a referral to send you out. I do have some more questions for you. Would that be okay?
Yeah, it's fine.
Okay. Have you been having any physical reactions to these stressful events, like heart pounding, trouble breathing, whenever you're reminded of that?
Yeah, I feel like my heart's pounding all the time, and I have difficulty breathing. Obviously, I think about people dying, like you'd feel the same way, so.
Okay. Yeah. Do you avoid activities or situations that remind you of that event?
Yeah, yes, I do. I avoid pretty much everything that I can avoid. I don't like interacting.
All right. And have you noticed feeling emotionally numb around the people that care about you?
Yeah, they don't get it. So it's just me and my thoughts. Nobody else is going to be able to help me with that.
And you've noticed that as well with them?
Yes.
Okay. All right. Well, it sounds like you definitely qualify for outpatient care. I'm going to go ahead and refer you out to a psychiatrist, okay?
Hey Nate, I'm Dr. Crawford. Is it alright if your friend's in the room with you today?
Yeah, it's fine.
Great. So, I just received your referral from the ED. They said that you had a relapse in your PTSD, but how are you feeling today?
I feel fine the other night. I got drunk, hit my head, and apparently that means I got a drinking problem.
It's not the drinking that I'm concerned about. It's your PTSD, and I think that you need to get some help again.
I don't really want to get help. I'm in the military, you guys aren't, you don't understand?
I actually served 3 years in Afghanistan as a medic. I saw a lot of things, I experienced a lot, and I do have a lot of trauma surrounding that. So I definitely know how hard it is, and I sympathize with you of dealing with those thoughts day in and day out. But the most important part of dealing with your trauma is developing healthy coping mechanisms. And it seems like you're turning to alcohol, which I think is making things a lot rougher.
Yeah.
So, you said you already been through this once. Were you diagnosed with PTSD once before?
Yeah, I got prescribed Zoloft and I took it for a little bit, then got rid of it.
Okay.
It wasn't working.
How long did you let the medication work for? About how long did you take it?
I took it for about a week.
Okay. Well, medications such as Zoloft usually take about 4 to 6 weeks to have that full effect. They can sometimes make you feel worse in the first weeks of taking them because your body just needs to adjust. I want to ask you some questions. Are you okay with that?
Yeah, that's fine.
So I have your initial assessment here that you took in the ED. Your labs and imaging are unremarkable, but you scored pretty high on the PTSD risk assessment.
Okay.
So I noticed a couple risk factors for PTSD that apply to you, which would include your military service, your poor support system, and then I believe you stayed in service after your traumatic event, which probably stressed you out even more. Is that correct?
Yeah.
Okay. I'm gonna have you fill out this questionnaire for me, if that's okay.
Done.
All right. Oh yeah, you scored pretty high on this. So I definitely think based on your history, the ED findings, and this questionnaire, I 100% would say that your PTSD has had an exacerbation. Would you agree with that?
Yep.
Okay. Well, you know, considering my trauma and what has helped me in the past has been journaling my triggers, nightmares, and positive coping mechanisms. I think I'm going to highly recommend to you that, you know, you start journaling, as well as schedule yourself some cognitive behavioral therapy. I also want you to receive support as soon as a traumatic event occurs. And I think I'm going to prescribe you prazosin for your nightmares and up your Zoloft dose. Does that sound okay to you?
Sure.
Okay. I'm going to have my nurse reevaluate you in 5 weeks to see if those medications are beneficial. It was nice meeting you, Nate.
Hi, how can I help you?
I need to pick up my prescriptions.
All right, name and date of birth.
Nate Stillman, 2/16/94.
Okay, looks like you don't have any food or drug allergies, not taking any medications, and no herbal supplements.
Correct.
Okay, your prescription, we have Zoloft 50 milligram tablet taken daily, and then prazosin 6 milligram tablet taken twice a day. Both can be taken with or without food. Avoid drinking alcohol, and don't stop taking these medications abruptly. It's important for you to monitor any mood changes, suicidal ideations. If you start to feel suicidal, go to your doctor or the emergency room. Monitor for any restlessness, hallucinations, loss of coordination. If you feel like your heart is racing, contact your physician as well. And I have this pamphlet here. It goes over all the other adverse reactions that you may experience, and will answer all other questions for you. Do you have anything else?
Nope. Thank you.
Alright.
Hey Nate, it's good to see you. How have you been?
I've been pretty well.
That's great. Have you been taking your medications and going to your appointments?
Yeah, I've been attending my support group. I actually have a meeting coming up, and Zoloft has been faring well, as well as the prazosin.
Good, I'm glad to hear that. How have your drinking habits been?
Honestly, I only drink socially now, which is probably every once in a couple weeks when I go out with friends.
That's great to hear. Now update me on your sleep hygiene and if you've had any nightmares.
I definitely get more sleep than I used to, around 7 to 8 hours a night now without interruptions. I still have nightmares periodically, though not as much as I used to.
Great. Now be honest with me. Have you had any thoughts about harming yourself since starting your Zoloft and getting clean?
No, I haven't any thoughts of suicide or flashbacks, really.
Great. And as far as triggers go, have you been journaling those?
Yeah, I keep my journal on me most days. I've noticed I still get anxious in public settings, though I'm not having as many symptoms as I once did, like the heart palpitations.
Okay. And what about those positive coping strategies?
Yeah, so whenever I feel like I'm having an attack, I remove myself from stimulation and I do some deep breathing, which really helps. I've been using an app on my phone, which sort of guides my meditation.
That sounds great, Nate. Well, keep up the good work, and Dr. Crawford will see you next week for your cognitive behavior therapy session. It was nice seeing you again.
Nice seeing you too.